Today we're talking to Adrian, who is a chartered physiotherapist at the Warr Clinic, about rotator cuff injury. So tell me, what is rotator cuff injury?
Well, the rotator cuff are the collection of tendons that come out of the shoulder blade and wrap around the humeral head. And the humeral head is on top of the arm bone, so that's basically where the shoulder joint is located. Now, when you have an injury to the rotator cuff, what tends to happen is that the tendon becomes sensitive, painful. It doesn't inflame, or it doesn't inflame for very long at all. Not like if you tore a muscle or a ligament for that matter. You don't tend to see the inflammatory markers that we see in other tissues.
And what are the sort of symptoms that I would expect to have?
Well, with a rotator cuff injury, you'll often find that movement will be a problem, and it will be painful as opposed to restricted. So when you go to lift your arm, you'll find that at some point during that movement, pain tends to occur. And if you can go past that pain by sort of a little jingle of your shoulder, you can often get the arm fully up above your head. For other people, sometimes they find that the majority of the movement is restricted. Is pain-free, but then when they get to the end of range, they tend to find it's uncomfortable when they're perhaps going to lift a jar off a shelf. The shoulder can be quite painful at night, and that's another reason why people suddenly notice something's wrong with their arm, is they're rolling over and they're sort of waking up with pain. And particularly for women, trying to reach the bra behind the back, trying to get the actual hand up behind the back is where you sort of maximally stress the tendon, and that generally brings on pain. The arm can sometimes be weak. If it's significantly weak, or if you find that as you're trying to lift the arm is rotating in, or if we resist your arm, there's absolutely no capacity to resist that movement, then that will often indicate that there's more than likely a significant tear, which may require a surgical approach.
What's the difference between that and frozen shoulder?
So rotator cuff injury concerns the tendon, whereas a frozen shoulder concerns the capsule, which is obviously underneath the tendons. And the difference between frozen shoulder and rotator cuff most notably is restriction in movement. Frozen shoulder is generally exceptionally painful to begin with, and then as you try and lift the arm, the movements become over time more and more limited. And what you find is where you can, with a rotator cuff injury, you can lift it past the point of pain. With a frozen shoulder, you can't lift it past the point of pain, but more to the fact that the actual joint won't move at all. Even I couldn't move it. There's a physical block, and that physical block will either be the capsule shrunk, or you've got adhesions inside the joint, which actually is limiting the movement from taking place.
So if I've got a rotator cuff injury, how would you treat it as a physiotherapist?
Well, what you tend to find is that the movement's painful. So if the movement's painful, the arm won't move properly. So the first and foremost important thing to do is to try and reduce pain. And we can do that by massage, we can do it by friction mobilization, we can do it by trigger point release, we can use acupuncture, we can use some forms of electrotherapy, and we can use taping. We can also give advice on appropriate medication, and we can also liaise with your GP to advise on medication which would help reduce pain. Once we start to reduce pain, the arm's going to move in a much more favourable or normal pattern of movement. That way you're going to reduce a lot of the abnormal tensioning that occurs around the shoulder. For example, when you go to lift your arm, you might be hitching the arm up, which could give you a lot of pain around the trapezius muscles. It could build up a lot of tension around the back of the joint and really adds to the overall dysfunctional movement. Once you've got past, or some way past that painful phase, you really want to start loading the joint and exercising it and putting some resistance through it. A tendon really becomes, or starts to become a problem because it becomes deconditioned. And the deconditioning basically means that the actual tendon can't tolerate being loaded. So to get it to tolerate being loaded, you've actually got to exercise it. And to do that, you've got to start lifting weights or pulling rubber bands, and that way it will stress the tendon and it will start to get start that healing process and regeneration process.
This is a really difficult question, probably, but how long might it take to get better?
Well, I think a couple of weeks is really a normal length of time to start to get a decent reduction in pain. But trying to rebuild the tendon and regenerate the tendon can take, sometimes 2 or 3 months. But that doesn't mean you need heaps and heaps of physio. It means you need to be really, really good with your exercises. And if you can do that, you'll probably find that there's a decent recovery phase. If after sort of 3 weeks we find that you're not really progressing, we may refer you on back to your GP and then on to an orthopaedic surgeon. And things like injections can be helpful, and surgery can be helpful. Surgery can be helpful if you've got a significant tear, but if you've just got pain, then we know that physiotherapy can be just as good, if not slightly better than an operation, because you haven't got to go through an operation.
And the recovery.
And the recovery, if you have an operation, if you recover from an operation for a rotator cuff repair, can be many, many months.
Right, okay. Thank you very much for that, Adrian. And I hope that's given you a little bit more information about what actually a rotator cuff injury is. And as always, if you want some more information, do give the clinic a call and have a chat with one of the physios. They'll be only too delighted to help you.